Welcome to Theme 2. In this video, we will discuss the screening process in more detail. The screening process entails following the oral pre-exposure prophylaxis algorithm. There are 5 important tests to do before initiating someone on oral PrEP, namely an HIV test, renal function, hepatitis B, screening for STIs, and pregnancy tests. When someone is tested negative for HIV, the next step is to assess the level of risk of the patient. This can be quite complicated and requires the development of a rapport with the patient. On screen are some questions that may be helpful in establishing whether or not someone is at increased risk for HIV and may require PrEP. Some questions include: do you ever have unprotected sex? Do you ever have unprotected sex with a partner who is HIV positive? Do you ever have unprotected sex with a person whose HIV status you do not know? And do you ever have sex under the influence of alcohol and/or drugs? We are very careful in our counselling to remain non-judgmental. Also remember, no one particularly likes being told that they are at risk, so keep that in mind when counselling a patient. Saying things like, people whose partners are more than 5 years older than them have an increased chance of HIV, may be more helpful than saying, you are at risk because your boyfriend is older than you. If you feel that a patient is low risk, but they feel that they are at risk for HIV, and they request PrEP, we do not deny them access, and this is reason enough to continue with screening. We recommend same-day initiation, but if that is not possible, initiation should happen within 1 month of screening. For same-day initiation, you will have already done the HIV test, assessed the risk, and conducted risk reduction counselling. You will also have done all the other screening procedures that day. You will dispense PrEP the same day after doing the following: providing combination prevention, as we spoke about earlier, including condoms, STI screening, pregnancy screening, provision of contraception, and providing other methods of HIV prevention. You will educate the client on important points, including side effects and practicing effective use, and ensure that all their other SRH needs are met. Lastly, you will prescribe PrEP as a combination of TDF 300 mg and FDC 200 mg in a fixed dose combination tablet per us daily for 1 month. At this visit, you will provide a script for 1 month's worth of PrEP and give the patient 1 month's supply. You will then give the patient a follow-up date for 1 month's time. If you do not do same-day initiation, you must initiate the client on PrEP within 1 month of screening. Initiation within 1 month of screening the patient is important because the other test results will still be relevant. However, you must still repeat the HIV rapid test. Other important information the client may need. Note that in the bottle, there are usually 28 tablets per bottle for 28 days of oral PrEP usage. Patients need to be reminded to store the drugs at room temperature and not put it in the fridge or store them in the sun at home. That was an enormous amount of information, but it basically boils down to the fact that there are 5 important steps in clinical screening. You have to test for and be sure to exclude HIV. You must test renal function with the creatinine clearance test. You have to test for hepatitis B. You must screen for STIs. And lastly, you need to perform a pregnancy test. Same-day initiation is encouraged, but if that is not possible, be sure to initiate the patient within 1 month. At that visit, confirm eligibility, repeat the HIV test, provide combination prevention, counsel the patient effectively, and script and dispense 1 month supply of oral PrEP. There are 28 days worth of PrEP medication per bottle, and remember the bottle should be stored at room temperature. That is it for Theme 2. Remember to answer the questions below and then move on to Theme 3. You can come back to this video at any time and watch it as many times as you need to.